Hi, my name is Christine Bowen, and it is late on Christmas. Had to wait until my 2-year-old went to sleep before I could do my presentation. And I apologize if it's hard to understand me. I've been sick all week. So this presentation is actually about build capacity for my substance abuse prevention course. And the first thing I wanted to go over was most of the information I found was at the SAMHSA website, and they give an outline for each step that applies toward the strategic prevention framework. And I'll continue to go on about it because the second step in the prevention framework is on build capacity. Human and structural resources, they're essential for the community needs to establish and maintain a prevention system that responds to local problems effectively. And then prevention needs are identified to address what is needed for the local resources, and those that have the willingness to commit and motivation are ideal candidates. And the first question that we were asked was, how might you improve awareness of substance abuse problems and readiness of stakeholders to address these problems? And I found that there are key components of building capacity, like raising stakeholder awareness. And ways to improve that awareness of substance abuse problems is meeting one-on-one with the public opinion leaders. Meeting one-on-one gives that personal appearance that everybody really cherishes, making eye contact, getting to know them. The second one is asking the stakeholders to share information in their own sectors, because it's not really possible for you to meet everybody one-on-one, and it is helpful if you have one leadership role meeting outward, branching out. And the third one is submitting articles to local newspapers, church bulletins, club newsletters, different areas in the community where you can meet that personal basis with people that you may or may not know. The fourth one is sharing information on relevant websites and social media outlets. It's important to have credibility in order to spread the awareness effectively. And the fifth one is hosting community events to share information about and discuss the problem. If there's a large event that people are interested in, they're going to go and they're going to want to learn more about it. And the last one is convening focus groups to get input on prevention plans. Not one person is going to know everything, and it's important to have input from others. And these aren't the only sources to get the awareness out there. When it comes to spreading awareness, one has to be creative. That means checking with local high schools, community centers, places with a vast amount of people where it's easy to spread the word. The next question asked was, what can be done to strengthen existing partnerships and or identify new opportunities for collaboration? It's important to build those relationships with people and businesses that support your efforts so that you can strengthen existing partnerships. It's also important to build relationships with those that don't initially support your efforts, because even if someone isn't willing to be in a leadership role, they may be willing to help with other small tasks. And once people do get on board and understand how important the prevention efforts are in each community, they tend to become more engaged. Even if they're not totally on board at first and they see others are, it might help bring that relationship together. And then having relationships with different members of the community, like residents and community leaders, can offer assistance with prevention information and resources. They raise awareness of critical substance use problems, build support for prevention efforts, and ensure that prevention activities are appropriate for the populations they serve. And the different community sectors that should be included in prevention initiatives are law enforcement, local businesses, healthcare providers, local government, youth servicing agencies, neighborhood and cultural associations, as well as university and research institutions. And then another question that was asked of us was, what strategies might you use to improve organizational resources? And there's one that SAMHSA brought to light, and it's CAPT. They offer prevention collaboration and action toolkits. They contain prevention tools that strengthen, initiate, maintain effective collaborations with a wide selection of stories and tools that prevent substance misuse and improve health outcomes. And being clear and concise with the roles and responsibilities that are needed and determine how to achieve these purposes from the beginning will show that we have cultural competence. SAMHSA states that by working in a partnership with community members and involving them in all aspects of prevention planning, implementation, and evaluation, you demonstrate respect for the people you serve and increase your own capacity to provide prevention services that meet genuine needs. They build on strengths and produce positive outcomes. And then the last question addressed was, what needs to be done to develop and prepare the prevention workforce? And there's so much more than just completing tasks for each unit. The different resources that we need to have proper knowledge and skills include having the proper credentials, training, experience, cultural competence, and expertise in addressing the substance abuse prevention outlines for the community. To assist practitioners interested in substance abuse prevention, there's also an online training portal. It offers self-paced courses. Obviously, we all have busy lives, and it's hard to get away for prevention training. And the organization I spoke of before, the CAPT, they offer the prevention training now online. So that's really helpful. And that concludes step 2 of the prevention framework. Build capacity.